Oral cancer often begins with subtle changes in the mouth. If you notice persistent white or red patches, sores that don't heal within 2 weeks, or unusual lumps in your mouth while looking in a mirror, these could be early warning signs. According to the Oral Cancer Foundation, over 54,000 Americans will be diagnosed with oral cancer this year. Early detection is crucial as the 5-year survival rate drops from 84% to 65% when cancer spreads. When suspicious symptoms appear, many turn to the internet for answers. Research shows that oral leukoplakia, white patches, has a 4 to 17% chance of becoming cancerous. Red patches, erythroplakia, are even more dangerous, with 23% being cancerous or precancerous. However, self-diagnosis can be misleading. Only a professional examination can determine if these lesions are truly dangerous. A proper oral cancer screening involves visual examination and palpation of the mouth. Dentists use special lights that make abnormal tissues appear white, chemiluminescence. If suspicious areas are found, a brush biopsy may be performed. This painless test collects cells for analysis with 90% accuracy in detecting oral cancer, according to the Journal of Oral Pathology and Medicine. Biopsy results typically take 3 to 5 days. A positive diagnosis of oral squamous cell carcinoma, which accounts for 90% of oral cancers, can be devastating. However, when caught early, stage 1, the survival rate exceeds 80%. The report will detail the cancer's grade, how abnormal cells look, and stage, how far it has spread, which determine treatment options. Treatment depends on cancer stage. Early-stage cancers may require only surgery, while advanced cases need combined approaches. Surgery removes the tumor with clear margins. Radiation therapy follows in 60% of cases. Newer treatments, like immunotherapy, using drugs like pembrolizumab, show promise, with 15 to 20% of patients responding well, according to recent clinical trials. Surgical procedures vary based on tumor size and location. Small tumors may require simple excision, while larger ones need complex reconstruction. For tongue cancer, surgeons often remove the tumor with a 1 to 2 centimeter safety margin. Microvascular surgery can transplant tissue from the arm or leg to rebuild the tongue, with success rates over 90% in major cancer centers. Post-surgery recovery takes 2 to 6 weeks. Common challenges include difficulty swallowing, dysphagia, and speech changes. About 35% of patients need temporary feeding tubes. Pain management combines medications with therapies like acupuncture. Speech therapy helps regain communication skills, starting with simple exercises and progressing to complex sentences over 3 to 6 months. Psychological support is crucial. Studies show 22 to 57% of oral cancer patients experience depression. Support groups significantly improve coping. Participants report 40% better emotional adjustment. Family involvement increases treatment adherence by 65%. Mindfulness techniques can reduce stress hormones by 25%, aiding both mental health and physical recovery. Prevention reduces oral cancer risk by 75%. Quitting tobacco decreases risk by 50% within 5 years. The HPV vaccine prevents virus-related cancers, now 70% of oropharyngeal cases. Regular dental checkups catch 85% of early lesions. Monthly self-exams using a mirror and bright light can detect changes. Focus on all mouth surfaces for 2 to 3 minutes. 5 years post-treatment, survivors have an 85% chance of remaining cancer-free if it was caught early. Regular follow-ups, every 3 to 6 months initially, are essential, as 10 to 25% develop new cancers. Modern reconstruction often restores 90% of function and appearance. That scar in the mirror becomes a symbol of victory. Early detection truly saves lives.